through these three speakers from diverse geographies and, of course, digital input as well, would it not be appropriate to conclude that today the building a culture of health, occupational health and well-being is more than possible? And we are seeing a new paradigm post-pandemic across the geographies. The UK experienced the NHS, which is almost thought to be the Bible of universal health coverage. Now we are writing our own story of universal health coverage in India through National Health Authority and taking all the state governments on board, and how digital tools are being utilized, and all these startups, even Medibuddy, and they are being invited by National Health Authority to go on board to help the country take the benefit of digital technologies. Any questions that are there in anybody who has been in the audience today are welcome. Well, if there are no questions, I have one question for Dr. Shriti. The NHS has been alleged to be very slow to change. That's what we perceive in India, and even global health experts feel. So how you visualize NHS will respond to this change process that you're driving at? How would you look forward to the future?
Thank you for your question, Dr. Rajiv. It has taken, so I've worked in occupational medicine now for 25 years, and I know that colleagues before me doing the same job that I've been doing have been striving for this agenda year on year on year. So it's been a long time coming, and I think for us it's the pandemic that has really made a difference, in that it has really highlighted the value that staff, the people, and if you look at corporate organizations, they recognize the importance of valuing their staff, because staff equals productivity. And productivity sometimes in a healthcare sector isn't quite so easy to demonstrate. But we have learnt, we are learning, and there is definitely national engagement. And just last week, whilst I was in Mumbai, I had very good news that the 5-year Growing Occupational Health and well-being strategy has actually become a mandate by NHS England, and part of what chief executives across the country now need to demonstrate that they are investing in and supporting. So I think we have moved a long way. We have still a very long way to go, but we actually have a national mandate for the very first time. So yes, fingers crossed it goes the way that we hope it will.
So the times are changing, even for UK, right? So India will change faster. That's what people say. If UK is willing to change, India would be more than willing to change the world as well as itself. Thank you so much.
Yeah. One question I wanted to ask from Ashokji. Yeah, basically, since you were talking about all the health records has to come on the digital platform, so how the data security can be done? Because ultimately we saw recently in the AIIMS what has been happened, and all the health reports are coming in the digital form. Like Prime Minister also says that National Digital Health Mission is running under the Prime Ministership, and Ayushman Bharat Digital Mission is also going on, and Aadhaar card is being created and it is under process. So the portal is provided, like digital platform is different for different hospitals, and it's not been yet integrated. So government what planning to integrate all the digital health records in a unified, on the unified portal, like railway is having some other HIMS, AMC is having some other HIMS, all, I mean, hospital, private hospital having different HIMS working on it. But it is not integrated. Anybody having the Aadhaar card, and if they go to some private hospital, then again the CR number whatsoever has to be generated, but it not be integrated until unless the uniform platform will be provided. What is your opinion about it?
Yeah, thank you, sir. Firstly, I think, when we talked about the payments, it happened much quickly because of the core banking solution being uniform, right? That was the strength. I think the government has recognized this, and there is a group which is already working on defining the formats and so on. That's one part of the journey. The other part of the journey is aggregators like ourselves, right? While what I talked about to you was a one front-end app for the employer or the customer, but at the back end it is kind of different for different providers. By being on the virtue of our platform, we have already kind of standardized most of these records. In fact, we're kind of working with ABDHM also to make sure that these formats are translated into their requirements. I think as more and more players like ourselves come in, and more, so when I say an aggregator, we aggregate a pharmacy, we aggregate a hospital, we aggregate a lab, because most of the labs in India are still a mom and pop shop, barring few chains, right? You can't expect them to invest in that kind of digitations and so on. And players like ourselves are enabling that and making sure that that data kind of flows in a simple format or a unified format, which can be later kind of being made interoperable. It's a journey, but I'm pretty sure, like Dr. Rajiv mentioned, we will take it much faster. The changes have come in the last 3 years much faster than what we have expected. With the government's push on that, I think just something which happened in the payment gateway will also happen here. And today morning I actually traveled by DigiYatra, which we would have never experienced earlier, right? So yeah, I mean, it's a journey, but it will definitely happen.
So UPI in healthcare will come.
It will.
That's what he's trying to say. Thank you so much for your patient listening. And of course, now we are in the last part of our session, of our day. So we will proceed further for this. Thank you so much, all the three speakers, and interesting discussion, interesting propositions. And we look forward that we shall have a culture of occupational health and well-being sooner than we visualize. Thank you so much.